In this video, we will talk about the antihypertensive drugs. High blood pressure is a common condition in which the force of blood in wall of your artery is often too high. Factors that affect blood pressure like cardiac output, blood volume, resistance, and blood viscosity. Blood pressure can be measured with a sphygmomanometer. When your heart beats, pressure on your wall called systolic pressure. When heart relaxes between beats, a pressure called diastolic pressure. Antihypertensive drug used to control the hypertension by reduce the cardiac output, reduce the peripheral vascular, and reduce the blood volume. Antihypertensive drugs classify into diuretics and medication that inhibit sympathetic nervous system and renin-angiotensin system and vasodilator.
Diuretic like thiazide by secretion of proximal tubule travel to ascending limb. Here it bind to chloride binding site of sodium chloride to cotransporter and inhibit its activity. So subsequent activity are also decreased and water absorption decrease and more water loss in urine. Thus urine output increase and blood pressure decrease.
Beta blockers like propranolol and atenolol. Beta blockers bind to beta-1 receptor. By it, stop binding of epinephrine and norepinephrine to beta-1 receptor. By this, decrease the energy need to open the calcium channel, so calcium channel will be closed, and with decreasing the calcium entry to heart, the conductions slow down, and these reduce the strength of the heartbeats, and blood not push out as much force, which is lead to reduce in the blood pressure. Alpha blockers like prazosin, trazodone, and doxacin decrease the sympathetic vasoconstriction, but their action can lead to excessive beta receptors mediated reflex that increase the heart rate and produce a tachycardia. Non-selective adrenergic antagonists like carvedilol and labetalol, they do action by inhibit the beta receptors in heart, which reduce the blood pressure without induce the reflex of tachycardia.
These inhibitors like ramipril and enalapril stop ACE from to conversion from angiotensin 1 to angiotensin 2, reduce level angiotensin 2, and this cause relax of blood vessel, then reduce blood pressure to normal level. Also, this lowering of angiotensin 2 allow more salt to pass through kidney and then take water with it into urine, and this reducing of fluid means there is small volume of blood for heart to pump. This by relaxing blood vessel and reduce fluid cause reduced blood pressure. Vasodilator like amlodipine dilate blood vessel, cause relaxation of smooth muscle and reduce peripheral vascular resistance. They work by 4 mechanisms. The first one is releasing of nitric oxide. The second one is opening of calcium channel. The third one is blockage of potassium channel. The last one is activation of dopamine receptor.